So welcome everyone. My name is Dr. Ruby Natale, and I am the co-lead of the Community Wellness IPC, along with Dr. Maite Shankar. Our IPC was asked to host this month's Grand Rounds, and we are very fortunate to have Dr. Rebecca Shear as our guest speaker. Dr. Shear is an associate professor, soon to be full professor as of June 1st, in the Department of Psychology in the Child Division on the Coral Gables campus. She's a child clinical, community, and school psychologist and early childhood researcher by training. Dr. Shear is a former early childhood practitioner and has conducted research in partnership with Head Start and the early childhood programs for over 20 years. She became interested in research after working as a practitioner and an early childhood teacher and experiencing the challenges that families living in poverty face when finding developmental and early intervention services for their children. Dr. Shear's research focuses on children's social emotional development as a foundation for school readiness. Her research interests include the development of classroom assessments and interventions to support social emotional competence and school readiness for preschool children living in urban poverty and those with disabilities. Today, she'll be talking about community-based partnerships for school readiness, challenges, and opportunities. And it's my pleasure to welcome you, Rebecca, and take it away.
Thank you. Can everybody hear me? Yes? Okay, great. Thank you, Ruby. Thank you. I'm excited to be here and really grateful for being asked to present to all of you and to see, I guess, I can't see you all, but some new friends and old friends. So I have prepared about 45 minutes or so of a talk. There's some videos. I'm gonna talk data to those of you who are data nerds like me, and talk practice to some of you who are clinical practitioners, and have some time for discussion at the end.
It actually came left.
And if you can mute your microphones,
Came back to Houston, and it
be
was
helpful.
the land was already saturated.
I don't know if the person running the Zoom can mute everybody else who's here.
Everything turned off. We all had oxygen.
Yeah, thank you.
Perfect, thank you. Okay, interesting conversations, that's fine. Okay, and I have 3 children at home, and they share with me lots of love and lots of germs. I'm a little bit sick today, but we'll get through it. So let me know if you can't hear me. I'll try and speak up. Okay, so these are the key takeaways for my talk today. That, and many of you know, actually, if you could just type in the chat, it'd be helpful for me to know what your role is. Are you a student? Are you a practitioner? Are you, I recognize some of you here on the call, director of early learning programs, or someone, if you could just type that in the chat so I have an idea of who's here, that would be helpful. So we know that early childhood is a strategic time, an important time in development for intervention and prevention. So it's one of the key takeaways I want to focus on today. Really exciting opportunity is to think about how we can leverage big data or administrative data that's already being collected in early childhood programs and agencies, and use them to link and align agency efforts to support children. And so I'll talk to you a little bit about some examples from the work that we're doing here in Miami, and a little bit about the developmental model that we've developed. If nothing else, you come away thinking about and always wanting to choose a relationship-based, strength-based, and community-based model for any kind of administrative data linkage and data work and research that can benefit or promote system-level change. I just wanted to start out by saying that, so as Ruby mentioned, and Ruby is one of the collaborators that I'm grateful to have a collaboration with at Mailman around this work. Coming into this work as an early childhood provider and practitioner, what many of you are, thank you for sharing on the chat. I had the experience of starting out in one place and moving. And so it's been a little bit of, it's been a privilege and a journey for me to get to this place in my career. But I'm always trying to center myself on children, on the child, on children in families, in the community. Our systems are not centered on children, that centered on the child, centered on the community, centered on families. I always try to bring myself back to that. But I started out as an early childhood teacher and as a developmental psychologist working with babies in a high-risk developmental program, and screening children and trying to help parents. Many of them were newly immigrated from low-income families, low-income, living in poverty, not understanding how to navigate the early intervention system, what developmental normal development looks like, and realizing that there are so many different systems that needed to be changed to better serve and connect families to needed services. So I started out way back when focusing on just early assessment and early intervention and social emotional interventions in preschool classrooms. And now I'm like over here entering into this big data world, which is really exciting, but it's also a bit uncomfortable. So I just want to shout out to those of you at different places in your career where it seems a little bit uncomfortable and frightening to you. You can do it. You just have to keep your passion and yourself centered. So what I'm going to present to you today is a little bit of what's making me uncomfortable, but also exciting at the same time. So thank you to our team. As I was saying, we use a developmental ecological model. Many of you are familiar with that model from Bronfenbrenner. And our team, in fact, is child-centered, dynamic, and multidimensional. We come from lots of different disciplines. Shout out to all of them. And there's many, many more. These are just some of them participating from the UM side in the work that we're doing. We have agency partners, shout out, thank you, and to our funders. I'll come back to this. These are larger agency data custodians and data sharers. We'll come back to them in a moment when we talk about the integrated data system work. And our shared goal amongst our community partners and community agencies is to build and sustain a data sharing partnership that promotes alignment and ultimately to improve the school readiness and support school readiness of children in Miami-Dade. Also, finally, and most importantly, or not least important, are our community partners who been grateful to Mailman, many of you at Mailman, including Ruby and Dr. Brosco for connecting our team to these three communities and the community leaders that we're working with. It's been a wonderful experience for us, and we hope to continue the work that we're doing. And I'll tell you a little bit about that in a minute. Okay, so history, where did it begin? So, so this work began now, years ago now, as a 2-year planning grant. We got some initial seed funding from the Institute of Education Sciences to create, it was a researcher practitioner collaborations program. I don't know, they haven't had that call come out in recent years, but I think they may be considering bringing it back. I know that other funding agencies have been soliciting for researcher practitioner collaborations programs outside of Department of Education, which has been great as well. At the time, the director wanted to establish true partnerships between education agencies and university researchers and sort of get away from that siloed academic work that we, often we do, right? You do research in the community, drive by, collect the data, publish your data and findings in some peer-reviewed journal that a handful of academic people read. So the idea was for researchers invested in early childhood, in the case of education, in the case of us, it was early childhood education, to form formal partnerships where we could identify and address or kind of pursue in our research an issue that was of relevance and concern to the education agency. And the idea was so that to increase the responsiveness of the research that we do as academic researchers to what the real needs are in education agencies and programs and public school systems. So we applied together with the school district and an early childhood program and early childhood office, as well as some of the early learning programs in Miami-Dade County. And we were awarded this 2-year planning grant, which actually ended up turning into like a 4-year grant, which has been great. And the focus really was on building capacity for aligning across early childhood into kindergarten. And the consensus was, I don't know how many of you have experienced this as practitioners or as researchers, working with special, children with special needs or different kinds of groups of children, is that, oftentimes we provide lots of resources to children and families before they enter, for Part C, for Part B, early intervention, before children transition into kindergarten. And then after they transition into kindergarten, they're kind of all of that history of what they have experienced kind of gets lost and doesn't always travel with them. So kindergarten teachers, what we were hearing is kindergarten teachers were saying, well, children are entering our classrooms. We don't know about their development and what they have, the kinds of services they've received prior. And, one of the partners that I worked with for many, many years, the Head Start program, would say, we know we are giving lots of resources to families, providing a lot of support to children. We know we see benefits, but then we can't find the kids. We can't track the kids as they're transitioning into kindergarten to really, establish some form of evidence of the positive benefits that we provide. So, and that's kind of the figure here. And then I heard a loud bang and turned around and he was gone. It's kind of like that gap between early childhood and kindergarten that we wanted to address. And so the goals for that work were to develop this formal data sharing partnership and collaboration. And that we were centered around these shared inquiries, which were questions about, how do we learn or know about, how do we know about how many kids have had some kind of formal preschool experience before they enter kindergarten? How do we know of those children entering public kindergarten, what early childhood experiences they've had? That was the primary one. And how do we collect and connect data systems to explore that question? Also, there are many questions, and this is in partnership with the Children's Trust, who were very interested, as well as some of the early of Head Start and the early childhood programs funded by the Early Learning Coalition and the district. Where are there pre-K programs throughout the county? Where are ones that are of high quality that families can access in the community? And that led to other questions around what are resources available to families with young children in the community. And then there were also more data nerdy questions like that are also very important. Does participating in early childhood programs relate to better outcomes for children as they're entering kindergarten? So those were the questions that we had shared on the table that we put forth in this first initiative. And we continue to have those same questions that we're working on. We know here in Miami-Dade, many of you have probably seen this, but that there's disparities across the county. Now, this is a little bit of an older map, but many of the patterns are probably very similar. You can see that on the left side, the darker areas of the county. This is a map of Miami-Dade County. The darker areas in the legend are census tracts where children are living in deeper poverty. And you can see there are these areas of the county. I know that Mailman Center has a focus here in the central and northeast region of the county, and a lot of the resources and efforts that you and programs that you're providing to the community. But you can see these are the darker areas, living in where children are living in greater poverty. On the right side, you can see that's negatively correlated with how ready children are for kindergarten. So there are these disparities geographically across the county, and we really wanted to know more about what was going on and how we could address those. So I have a quick video. One of the ways that we thought we could do that is using big data and integrated data systems. I have a quick video, so I'm gonna play that. I think you'd be interested to see if I can get it to work. I'm just going to play about a minute of it.
Grounded information in order to respond effectively.
Let's try it.
Many urgent national problems require scientifically grounded information in order to respond effectively. Unfortunately, public administrators don't have access to the right data-based information to respond to these challenges. The reasons for this gap are complex. Today, data collection and sharing is primarily driven by the compliance requirements of the budget cycle. Instead of a quality improvement approach that turns data into information in order to improve practice, the data collection system is largely rote and uninformative. Performance management is often dumbed down simply to do it, record it, and report it. And evidence-based research and evaluation often lag substantially behind the decision-making process, if they are present at all. Ongoing scientifically informed measures of program quality and effectiveness are rare. There is little disciplined reflective practice in the system. Things get done and redone, whether they work or not. Past mistakes get repeated over and over again. Hence, there is a disconnect between the compelling need for quality information to answer important questions about big social problems and our ability to generate it. Public administrators need the answers yesterday. Researchers say they can't provide it until tomorrow. And practitioners who need the information today are forced to improvise. Actionable intelligence is a new approach to policy development. AI is a knowledge-to-practice development cycle that puts timely and relevant information into the hands of stakeholders. The process begins with administrative data across agencies on what is being done in the field related to a specific social problem. This information fosters dialogue among stakeholders about what is working and what is not, and generates an intentional action plan to improve practitioners' effectiveness, which is then tested using data. AI was developed in part because we need a faster knowledge development cycle to foster innovation in social policy. Rarely do new ideas, including social programs, work on the first attempt. Successful innovation results from a trial and error process of this data, dialogue, do cycle. So, it is as important to know what doesn't work as it is to discover what does work. Failures inform course corrections, and those corrections lead to better programs. The AI approach is supported by integrated data systems.
Okay, so I'm gonna just pause that for right now. If you're interested, this is the website. You can check it out. It's a wonderful resource, and we're actually part of our Miami site as part of this AISP network. So I really, recommend that you check it out if you're interested. All right, so let's see if I can go back to share my screen. So that's what integrated data systems are, and we're part of one of the sites, the national sites here. Here in Miami-Dade, it's called Ideas Consortium for Children. I'm going to talk to you about that now. And if you're interested, that there's so many wonderful resources on the AISP website for you to check out. Legal resources, practical resources, technical resources. So wonderful resources there for you to check out. Okay, and I just wanted to say here too is that we are considered, if we were thinking developmentally, because I'm a developmentalist, where we are at in terms of our stages of integrated data systems, we're really, I don't know, actually, sometimes we go back and forth, like maybe we have our backpacks on going into kindergarten, I'm not sure, or we're still in our toddlerhood, infancy and toddlerhood. It's a lot of work and continued relationship building and strengthening of lots of different legal and technical structures. So I go back and forth, but we're definitely not further along than entering kindergarten. Yeah. Okay. And okay, so let me tell you a little bit about our integrated data system, and then I wanted to ask you all a question. So, so this is our current name. We're called Miami-Dade Ideas Consortium for Children, or Integrating Data for Effectiveness Across Systems. These are our current data sharing partners. Miami-Dade County Public Schools, the Early Learning Coalition of Miami-Dade Monroe. Many of you will know them. They are responsible for administering the state-funded programs like the voluntary pre-K programs and the school readiness subsidy, childcare subsidy programs. The Children's Trust is one of our data sharing partners, and they provide a lot of services, many of you are aware, to children in the community and in schools. We also are partners with the Miami-Dade Head Start and Early Head Start program, as well as the CRIS, Child Registry and Information System, which is part of the Part B, preschool early screening and identification system, which is part of the statewide. Christine Delgado runs that at the University of Miami, and it's a statewide registry for child find for Part B. And then us, University of the Psychology Department, which is me. So these are some of the data that, this is how it works. These are some of the data that we're currently integrating. There are different legal allowances that allow us to do this work. So we have a larger data sharing agreement, which allows us to get identified data across these different partner agencies to share to University of Miami, which is the IDESC, the Institute for Data Sharing and Data Science and Collaboration, which is the computing center here on the Coral Gables campus. Identified data are shared to them. They are then curate the data, link the data for whatever research needs, and then it comes back out through a data use license. Mostly it's all been internal at this point to us, where we're analyzing the data for different research questions that our partner agencies have. These are examples of some of the data elements that we've been linking. We've been linking a lot of prior data, and now we're in the process of updating our data with some new funding. So you can see there's a lot of, it's pretty extensive in terms of the data sets. They're mostly focused on education right now. We're hoping to bring in other partners. And this is a question I had for all of you to think about is, or you could type it in the chat, as a practitioner, as a researcher, as a educator, what types of data do you think you need that you don't have access to that would make your job easier in working with children and families? So if you want to type those into the chat, that would be helpful for me to have a little bit of a discussion around that. You can see also that we're linking into the K-12 system as well, so we can follow, we can answer some of those longer longitudinal questions about, you know, if children were flagged with an early with a disability during preschool, what are some of their outcomes over time, and what are some characteristics of those children over time? I don't see anything in the chat. But feel free to type them in. Are there any data that you feel like would be helpful to you that are not in your purview that would be helpful for you to know about? And do you have any feedback on the video that we just watched? I just wanted to take a pause to talk about that for a minute. I think it's really interesting that the quote that sticks with me is like, things get redone whether they work or not. I feel like as a practitioner that happened to me all the time. We would do the same thing even if it didn't work. We just didn't have a way to test whether it worked or not. I just wanted to pause for a minute. Any thoughts about that? Feedback, data, family dynamics. Great, thank you. Yes, health. I think health is so important. That piece is so important. Also thinking about too, as a educator, understanding, you know, if the child has been in the DCF system, how that is affecting and how, in terms of their placement too, and how that's literacy measures. Thank you so much. Mental health, emotional health, that's so important. And that's something that's so important too, in terms of kindergarten entry. Right now, we have access to administrative data, right? So a lot of the data that they measure, you know, a lot of the outcome measures in kindergarten are literacy, language, and math. So these are solely academic skills, and they don't include social emotional. We know how important that is. Okay, great, thank you. This is the model. This is how we operate. So ideas are generated in collaboration with our partners. Our programs who are comprised of administrators, educators, and policymakers. And we then link the data. We are centered. We have a common mission statement and values. And then we link the data and then share back the findings to our programs that we're working with. And we hope are using them to inform policy and programs. And it's kind of a cyclical, iterative process. All right. Okay, so I'm going to share with you some highlights. Oh, thank you so much for sharing about your daughter. Yes, for sure. Social, emotional, mental health is so important. We're trying to advocate for that in some of the work that we're doing with the school system right now, for sure. Okay, so let me share with you a little bit of the highlights from our ideas work. I'm just looking at the time, and then we'll have some time for questions. So initially what we did was we linked, I'll go back to this chart, we linked data across these early learning systems with the K to 12, but basically with kindergarten and first grade. We linked longitudinally all the children's prior early learning experiences to the K to their kindergarten entry data. And then the findings that I'm sharing with you today are some of the findings from that initial cohort. This is from a couple of years ago now. Okay, so here are some highlights. So what we found, and this may not be a surprise to many of you who work in early learning here in Miami-Dade, but this is the number of children that were served, unique number of children that were served across these different systems. Now, what gets to be very tricky is that there's no common identifier across all of these early learning programs. So if a child is in Head Start and then they received afternoon funding for VPK because they're 4, there's no way to link them except through these data algorithms using identifiable pieces of information like the first name, last name, date of birth, gender, home address, parent name, things like that. There's no common ID, which is really difficult. So it's really difficult at first glance. Everyone kind of knows who they serve in their own system. But then across systems, it's very difficult to know the actual number. So these are the numbers of children that we found were served across each agency system. And then we looked at across all of them, how many of them were actually, served in an early childhood program, a preschool program before entering into kindergarten. And what we found was that here, a large majority, about 83% of all children had some type of formal preschool experience. Many of them were just for the 1 year for the VPK program before they entered into kindergarten. And this is based on a cohort of children that we have been doing a lot of work on from about 5 years ago now, who entered kindergarten. So the majority had 1 year of experience, but a large majority of them had at least 1 year of experience. And amazingly, and then this is probably an undercount because we don't have all of the service systems linked to our data, that over 50,000 unduplicated children 3 to 5 are being served by early learning providers in Miami-Dade annually. And this, as I was saying, this is probably an undercount because we don't have all the service systems linked to our data system. Just a couple of initial findings, which are really important, and maybe, again, sort of like if those of you who are practitioners in the field or educators, it's kind of like, duh, these are really important, yes. But attendance matters. We found that children who were consistently attending in VPK programs as well as in Head Start tended to start, well, it's interesting, they start out the year with higher skills and then they gain skills more quickly. So, there's an interesting conversation to talk about those findings for sure, in that children coming in who are not attending as much as other children who are attending are likely facing additional barriers to coming into school that other children aren't in there. But being in school adds another additional benefit for children, both in preschool, we found this in Head Start and VPK, as well as in kindergarten. 2 years are better than 1. We found that Head Start, if you attended Head Start for 2 years, you outperformed children in preschool as well as in kindergarten when you entered kindergarten. And the final point, which I'm going to talk a little bit more about today with you before I end, is that, and this is a relatively new area that I've been exploring, or that our team has been exploring, so it's relatively new for me, is that communities provide resources and opportunities for children's development. So taking a closer look geographically at some neighborhood assets and neighborhood risks that influence children. We know that children are influenced by the proximal environments in which they live and the resources that are available to them in which they live. Okay, I see a question in the chat. We'll come back to that for sure at the end. That's an excellent question. Okay, so I just wanted to share with you a little bit about some of the work that we've done in the community, some of the community-based work and some of the work we've done around taking some of the data that we have and aggregating it at the census tract level to better study the contextual aspects around children's early development that make a difference for children's development, and try to study that a little bit more. Okay. So we have been doing a little bit of work now looking at neighborhood poverty, and what we did was we developed a vulnerability index, or essentially it's an index of neighborhood risk that comes from Charles Bruner's work and what he calls the Child Raising Vulnerability Index, and it's 10 census tract indicators of social, educational, economic, and wealth indicators. Some of these could be thought of as social determinants of health, but many of them have to do with SES, educational status, and poverty. And as you can see, the darker areas here are areas of census tracts in the county. Again, similar to the map that I showed you before, the darker areas are areas where children are experiencing multiple risks and tend to be areas of concentrated disadvantage and poverty and risk, where children are growing up in the county experiencing a greater number of these risks. At the time we did this, we'll have to do this again and update it, but 56% of children under 4 were living in a census tract with at least 1 or 2 risks. And about almost a third of them were living, under 4 were living in census tracts with 3 or more risks. So and we know that about 30%, and we think it's changed, it's improved a little bit, but with the pandemic, I'm sure that there's been a lot of changes, but that there's a substantial amount of children under 4 that are living in poverty here in the county. So what we did was we took that neighborhood risk map and we mapped a measure of children's kindergarten development or developmental skills. And this was a measure called the Early Development Instrument. Some of you may be familiar with this. This was a partnership, came out of a partnership that the Children's Trust had with the UCLA Center for Healthier Children, Families, and Communities and the school district. And what they did was, over several cohorts of kindergarten children, they had teachers complete this measure in the springtime of the children's kindergarten year. And the measure is comprised of 5 different areas: physical health and well-being, social competence, emotional maturity, language and cognitive skills, and communication skills, and general knowledge. And the use of this measure is supposed to be more for a community, it's more a community level measure to be able to inform community action. So what we did was, let's see what's on the next slide. Oh, this is just showing you what we did was we overlaid the two. We overlaid the kindergarten developmental scores at the census tract level with the risk scores that we've mapped from the Bruner to see whether there is a relationship. And so what do you all think? Do you think there's a relationship between how children do in kindergarten and the level of poverty and risk that they experience in their neighborhood environment? What do you all think? Do you think there's a relationship between that? And what does this slide show? Do you think there's a negative or a positive relationship between neighborhood poverty and children's kindergarten development? Go ahead and type in the chat or unmute yourself. A positive relationship in what way? Thank you for typing in the chat. The higher the neighborhood risk, the more, or the more on track you are in kindergarten in terms of your development, the lower your neighborhood risk. Yeah, absolutely. Thank you. Thank you. Thank you. Yes, of course. So, yes. So as children tend to be living in areas of higher risk in terms of neighborhood risk, that's less likely to be on track. And that's what we found here, is that as you're less likely to be on track in terms of your development in kindergarten when you're living in an area of greater poverty, you're experiencing more neighborhood risk. So this is just a really interesting set of work that we're starting to do. And I'm going to talk to you a little bit about what this is and where we're going, and then we'll open it up for questions. So what we did, like I said, is we overlaid the neighborhood risk index with this kindergarten development index at the census tract level, and we overlaid the two. And we came up with what's called, so folks have called this lots of different things. We're calling it the resilience index. We're open to feedback on that. Just for lack of a better term right now. But what we did was we overlaid the two. And so areas in blue mean these are areas where children are performing better than expected, given the neighborhood risks that they have been experiencing in their census tract. So there's certain areas of the county where, despite experiencing high levels of neighborhood risk, children are performing better than we might expect in kindergarten. And then right in the middle, these are kids that are doing, sort of performing as we might expect. On the right, when we have these red in areas, these are areas of the county where children might be experiencing less neighborhood risk, but they're not performing as we would have expected given those neighborhood risks. So what's really interesting about this work is that we started to take a deeper dive at the local level and local communities to find out, wow, what is the secret sauce? What is going on in some of these communities, despite the fact that children are experiencing many different early risks in their neighborhood? Why is it, what's going on? Why is it that children are doing so well in kindergarten? So this is the work that's really exciting and the next step in terms of the direction of the work that we're doing, and that Ruby's been helping us with, which I'm really grateful for, is we take a deeper dive. And so here I'm going to show you as an example the area of Little Havana. So these are the census tracts in that catchment area in Little Havana. And you can see there are many different census tracts here. Some of you may be familiar with this area that are blue. And the question for us then, and where we're pulling community partners in our different disciplines in, is like, what is it? What factors might shape or better support children despite the fact that they're living in living in neighborhoods that are placing them at risk for not having positive outcomes. And so these are some areas that we've been looking at: early childhood programs, community responses to crisis in terms of mental health, which is an effort that Ruby's been leading, affordable housing, that's another asset in the community that's really important, access to healthcare. And medical needs, but very, very, very important. So these are all of the folks that are at the table doing that. And what we've been learning is that interdisciplinary and interagency collaboration is really required for real solutions. Everybody, all of us have different hats and different disciplines. We're all siloed, even in, especially in, I was going to say even in, but especially in academia, right? In our own worlds. We don't talk to each other in the same way that systems are siloed that are collecting data about children. And so without discussing and talking and sharing our ideas about what could be at the root of the issue or the root of the problem or the solution, independently is not sufficient. So I'm excited for this next step. And just in practice, it's neat to be able to collaborate and to share information across disciplines, because we know children don't develop in a vacuum, and that they themselves are multidimensional in terms of the many different developmental skills that are emerging and need to be nurtured in the early childhood years. So just an example of what we've been working on here is that we have overlaid some neighborhood assets like early learning programs, and to look at where they tend to fall, and do they tend to fall in more areas of blue. in terms of resilience. And so this is just some descriptive, we're now working kind of descriptively at the descriptive level and trying to pull these into some more sophisticated data models. But you can see here that there's the green dots are accredited early childhood programs, the pink are non-accredited, and the little blue are public schools in the area. So we're finding that there tends to be more early learning programs in some of these blue areas that tend to be more likely accredited or of higher quality, but that's just some beginning, just in the beginning things that we're finding. Also in Little Haiti, less so, but less so in terms of accredited programs, but more non-accredited programs that are available to families, and that's some of the work that we're starting to do there as well. Also overlaying geographically some neighborhood funded, trust funded support programs from the Children's Trust. So you can see these are some different sites that they have in the trust is funding in Little Havana and Little Haiti area. So one of the things that I would love to hear more about and talk more about are what other indicators can we bring into our data system that are really important for us to contextualize children's early learning and neighborhood experiences. So I'd love your feedback on that as well. I'm just looking at the time. We've done a little bit, so I want to wrap it up, but we have done a little bit of a deeper dive with some funding from the University of Miami through the ULink to take a closer look at issues of equity across the county. And through that, we've been doing a lot of community partnership work, a deeper dive with our community partners to hear from community members about what they feel are indicators that are most important for them to be able to link to data systems and to be able to use to better understand and contextualize children's early development and well-being. And just some questions that we have for discussion around this is really important. It's like, who do we center in this work? Is it researcher? Shouldn't it be? But can we center children? Can we center families? Can we center communities? How do we do that? What is meaningful engagement? These are all questions on the front of my mind, is to think about our positionality as university researchers, as physicians, whatever your role is, and how are we engaging in meaningful conversations with our community partners, and how are they driving the research? That's really, really important, right? And these are the questions that I was thinking about. How does that influence also our assumptions about data, our assumptions about children's school readiness? If you're interested, this is a really great resource I wanted to share with all of you. It's a toolkit for centering racial equity through data integration, and we're using that right now as racism and structural inequalities have affected communities. They've also affected data and administrative data and data infrastructure. So it's a toolkit that we're using now to walk through at every stage of the process, to think a little more carefully about how we're centering the work that we're doing and how we're being reflective and intentional about the work that we're doing. We don't always think about it, and it causes us to slow down. Even in the urgency of the work that we're doing, it causes us to slow down and make sure that we engage all voices as much as possible. And only through that process can we move toward more equitable relationships in early childhood in the work that we're doing. Okay, so I have a couple more slides, but I'm looking at the time, and let me just quickly come through here to share with you some of the community perspectives, and then I want to open it for questions. So when we asked some of our community leaders and community partners about, and we're just starting this work right now, what are some factors in the community that support children and families? These are many of the factors that came up. So if I were to ask you, what are some factors that you feel in your community support children's well-being, or in different communities that support children's development and well-being, health and well-being, I would imagine you would have many of the same answers that are here. But this is some of what we got from them. And then we got feedback from them in terms of how how they would recommend we center racial equity in any of our data integration work. So, you know, having race equity as an agenda item in our planning meetings, partnering with people whose data are in the system, that's really, really important. Educating ourselves in terms of our own structures of implicit racism and implicit bias and things like that. So we're taking all these to heart in our work moving forward. This is the final thing I want to share. It's kind of fun. This is the partnership that we have with in Little Haiti, and we're taking some of the integrated data that we have and working with IDISC, which is at the computing center here on the Coral Gables campus, and taking some of the childcare availability data and putting it and making it available to families in the Little Haiti area through a partnership with St. La Early Childhood Center or Neighborhood Center. And they've created an app and they're using it to try and train trusted messengers in the community to work with families and also train families to use technology. So this is the name of the app. It's being designed for parents to access information about children's educational opportunities and health opportunities in this different area. And also I have a little video, I don't know if I have time to show it, that looks at, let's see, I can send you the video later if you're interested, but basically talks about the importance of different developmental milestones. If there's a concern about development, where should families go? It's all being translated into Haitian Creole. So it's just kind of a really neat outcome of the work that we're doing. If you're interested, this is our website. You can check it out. Always feel free to reach out to me. Mark Needle is our consortium facilitator, and you can also reach out to him. This is my email, and I'm happy to stop now and answer any questions. We have about 10 minutes left. I'm going to stop my share. I'm going to just, my cat is mewing on the outside of my door, so I'm just going to let her in. Hang on 1 second. I'll be right back. And then I'm happy to answer your question, Casey. Hold on 1 second.
While Rebecca is doing that, just a reminder to wait to the end because there's an assessment survey that everyone should fill out, and it'll appear on the screen as soon as the meeting ends. But also in the chat, they put the link to the form that you can access.
Okay, I'm here. I'm back.
Any questions for Rebecca?
I see that Casey has his hand up.
So I first, nice to meet you. Second, I think that maybe it might be beneficial if we schedule a longer talk. So the stuff I put in there, I'm actually doing research on, particularly right now, a dissertation on the impact inequalities in the family court system and divorce and child custody have on U.S. corporations. I'm a business student, and I estimate that the U.S. has U.S. corporations lose about $250 to $500 billion a year in productivity, utilizing mental emotional health as moderator and mediator to employee performance. So I've been collecting a lot of data on that, and I know a lot of the statistics on separation, single parents, stuff like that. And I think that while zip codes and neighborhoods and racial demographics are very visible and easy to capture, all of that is overlaid by the family dynamic. And I think that would be something very interesting to try and capture on top of that, because those children, you know, they experience that mental and emotional trauma that does affect them. And I'm actually, so some people here know, I'm also the executive director of the Father's Rights Movement, which is the world's largest nonprofit for advocating for equal shared parenting, because the state laws actually promote a divisive family court system. So we advocate for a rebuttable presumption of 50-50. So you go into court, it's 50-50, argue why it shouldn't be, thinking that it would better benefit children. And in that, we've created programs that help parents and children through providing the tools necessary to promote and facilitate healthy co-parenting, whether they're separated or together. So I think there's a lot of parenting tools that will help with that that process if they do get divorced for the benefit of the child. So like I said, I think there's a conversation we can have on another day. But I think that would be very interesting to overlay with your research.
Yes, no, I agree. And I think that, no, thank you for sharing that. I think there are some, like I was saying, we're at the very beginning of setting up an infrastructure that allows for multiple data sharing partners. And there are many different data elements that we would love to be able to bring in and to better, again, better study children's development, and many different opportunities that could be, that we could take as a next step for sure.
Well, I'm happy to participate and help in any way I can, especially on that matter, to overlay that.
Thank you. Thank you. That would be great. That would be great. Yeah. And if there's anyone else on the call interested in different aspects for different data for different agencies as it supports your own work or your own interest, I would be very happy to set up another call, talk more about it, and engage you. We have partner meetings every month where we have our partners come together and talk about the different projects that we have going on. So happy to connect with you and move the work forward. Also, if you're interested, if you're a student and you're interested in being a data nerd with us and analyzing any specific question for data we already have, or connecting in other systems to analyze for a different data use, we're very open to that and happy to invite you to join us as well.
I'm staff at Mailman, but I'm a data nerd. So
I think that yes, I'd love to set up a time to talk with you. I think I've met you before through Jason Jet.
Yeah, probably briefly. Yeah, it was a while ago, probably.
Yeah. So thank you for sure.
Mm-hmm.
Ruby, do you want to say anything?
Yeah, yeah, we try to end a couple minutes early, so thank you so much. And having been part of your team for a couple years now, I can truly speak to how interdisciplinary the work is and how you've done a fantastic job breaking down silos. I've mentioned before that I'd love going to your meetings because I get to hear from people from geography and history and civic engagement and the data science center, and have you pulled all of these people together that brings such a great perspective to the work is really inspiring. And I really also appreciate your strength-based approach. So many times we look at risk factors, and it's so nice that you're focused on, you have an actual resiliency index, right? Which we don't hear too much about, but focusing on what's going right in these communities and what is that secret sauce that is success, and how some of these kids thrive is really amazing. So privilege and honor to be part of your team. Thank you so much for coming today to talk to us. And I'm sure people will be contacting you to set up further discussion. So happy Friday, everyone. And thanks again, Rebecca.
Thank you. Yep, my door is always open. Please contact me. Happy to talk to anyone in the future. So thank you all for coming.
Thank you. And don't forget to fill out the survey.